The purpose of this video is to help professionals and paraprofessionals understand the importance of having a plan of safe care for families and caregivers of babies who have been exposed to substances during pregnancy. In addition to learning about the laws associated with plans of safe care, this film will provide examples of how to use motivational approaches to support families during this process. Pregnant and postpartum women with substance use disorder need knowledgeable and non-judgmental professionals to assist them in obtaining treatment and increasing their awareness about the effects of substance use disorder and their treatment options. Ensuring the safety and well-being of mothers, their infants, and their families when substance use is involved is very important. Asking the right questions, developing mutually reinforcing objectives, and understanding the risks for our patients is an important part of the plan of safe care. In July of 2016, the Comprehensive Addiction and Recovery Act was passed into law. The intent of the law is to ensure that needed supports for mother and baby are identified throughout their care and that there is a family-centered plan outlining the supports. States are required to report information to the federal government about the processes used and evidence that plans of safe care are developed and that a data collection method and monitoring are in place. Plans of safe care encompass the mother, even during pregnancy, and the caregivers and mother after the birth of the baby. The plan can be initiated at any point of entry, so settings may be different, but certain elements included should remain the same and may be done one-on-one or may be done with a team of professionals in a formal setting. When a nurse identifies the need for a plan of safe care, social work should be consulted immediately. Using motivational interviewing techniques is a very important part of working with women and caregivers. Understanding and recognizing that sometimes people are not as ready for change as we would like them to be is very important. Leaning into resistance, asking open-ended questions, affirming the woman, reflecting on what she is telling you, summarizing and informing and advising are all core skills of motivational interviewing. This role play shows how motivational interviewing, while developing a plan of safe care, can be successful.
Hi, Helena. My name's Dixie. Your doctor sent you here to talk with us about a plan for treatment?
Yes, she did. We were talking about taking care of my baby and finding a way to have a clean baby.
Okay, so tell me a little bit about how you think we can help you today.
I've been taking Dilaudid and Xanax, and I really want to have a clean baby and have a plan for recovery for myself.
Well, it sounds like you have a lot to look forward to. It sounds like a really hopeful time in your life. And, tell me some things that are really important to you today. What's the most important thing for you right now?
Definitely not having a call to DCF.
Okay.
Just having a healthy baby, being healthy for her.
Well, it sounds like you're on the right step. What if we could find a place for you today to go to residential treatment? How would you like that?
Not today, maybe next week, or maybe even tomorrow or in a couple days.
Okay. Do you have a way to get home from the hospital?
I'm not really sure. My car, it's broken down. It's about a mile away from here. I walked here. I sleep in it sometimes.
Okay, so it sounds like housing is probably going to be a part of your plan that we'll need to focus some attention to. And so can I ask, do you have a working phone? Does your phone work?
It works right now. I have a SafeLink phone. But if I call you, if I run out of minutes, can I text you?
Yes, and communication is going to be a really important part of developing a plan with you. I want to make sure that you're safe, that your baby's safe, that you're healthy, and that we have a way to communicate with one another. Okay, so we'll give you some information of who you can call, when you can call, and I think that'll really help you feel prepared for the next few days until we can set up treatment for you, okay?
Okay, Thank you.
For right now, what I really want to do is get a little more information about you and your pregnancy, okay?
Okay, sounds good.
Good.
The plan of safe care for a pregnant woman should include substance use history, mental health history, any previous treatment history, and referrals for service with a summary of the plan. There should also be a review of any health concerns she may have, such as infection, hepatitis, HIV, or any other chronic medical condition. Information gathered can be a combination of mother's self-reported information as well as documentation from the medical provider, behavioral health provider, or any other confirmed source. The information should all be considered in order to create a plan that supports a healthy pregnancy and a healthy infant development after the birth of the baby.
Alina, thank you so much for coming in today, and I really appreciate you being so honest. It takes a lot of courage to take this first step. I want to take a minute and I want to go over the plan with you, okay?
Okay.
All
So
right.
tomorrow I'll go to the health department,
Yes.
go to WIC,
Perfect.
okay, and talk to my mom about the decision. I'm really scared to do that. I have been such a disappointment to my family.
I understand your feelings. Communicating to family can be really complicated, but I'm really proud of you, and I know that you're going to do great.
Thank you. Thank you for understanding.
Sure. So here is my business card. It has my phone number on it. It has a number that you can text in case you don't have any minutes. Also here is a bus pass so that if you need transportation, you need to get somewhere, you can. Okay?
Thank you. Thank you so much. Thanks for being so nice. I didn't expect that when I came in today.
Well, you're worth it. I think you're going to do just great. You're not alone. We're here with you, okay?
Thank you. It's the first time I felt hopeful in so long.
Glad to hear it.
Conducting a plan of safe care meeting after the birth of the baby will be more comprehensive and include far more information. It is very important to address the infant's medical needs, follow up with pediatric care, assess the parent or caregiver's capacity to meet the infant's needs, and confirm the stability of housing. Pay close attention to issues such as safe sleep, supports for the parent, relapse prevention, and the ability to follow up on each of the infant's needs. Each infant should also have a referral to early steps, and the family should be connected to a home visiting component. In many instances, the hospital is obligated to contact the Department of Children and Families, and they are likely to be closely involved in the care planning as well. In summary, federal law requires that pregnant women with substance use disorder and their infants have a plan of safe care. Motivational interviewing techniques should be used to support mothers with substance use disorders. Physicians, hospitals, and other support personnel play a vital role in supporting safety and well-being through their communication with the caregivers, DCF, and home visiting, such as Healthy Start. Caregivers need to have a stable and safe environment for NAS infants. A plan of safe care provides information and guidance to the family and others involved with the infant's care. Understanding barriers and challenges of the biological mother can contribute to a successful plan. More information about plans of safe care or supporting mothers and babies affected by substance use is available.